my go-to doc.
And hi, this is Michelle. I'm a nutritional therapy practitioner.
And so in this webinar, we're going to talk about ancestral health and why we think that is the perfect template for a healthy lifestyle in the modern world, and also touch on why we think that trying to prove, what a healthy lifestyle is with modern research is not the best way to go about figuring out or proving what the best way of living is. That we already have the answer from hundreds of thousands of years of evolution. So Michelle, I guess to get started, can you just maybe start by defining ancestral health and what an ancestral health coach learns, what is that body of knowledge and what does it mean?
Yeah, so I think one of the things that maybe differentiates the ancestral health kind of frameworks to others is that it's broader than just what you eat. So there is the aspect of focusing on meats, especially organ meats, the really nutrient-dense foods like liver, and then whole foods like vegetables and fruits and nuts and seeds, and then kind of avoiding more of the agricultural things like grains that were invented after the agricultural revolution. So that's kind of the idea when it comes to food. But the thing I really like about the ancestral framework is that it really embodies so many different things. Things like, at least, so when I began this journey, actually, I'll say a little bit about this. I was into health, from when I was a teenager, but I would try calorie restricted diets. I tried being vegan. I tried so many different things. And when I think I was 23, I decided to go paleo. And that kind of really hooked me into this because it was just a broader framework than just what you're eating. And that really made a lot of sense to me. It was about movement, how to move in a way that's really nourishing for your body. How did we evolve to move? Did we evolve to run long distances for a long time? Did we evolve to sit? Like, we know that we didn't evolve to sit for 9 hours a day. There's so much nuance to it in terms of footwear. Now it's really popular to use minimalist footwear and not use all these padded and cushioned shoes that actually change the structure, the way in which you walk and the way in which you move, which can then cause injury. So that was a part of it. And then also in terms of sun, being out in the sunlight, not being terrified that sun is going to give you skin cancer. It also encapsulates things like skincare, natural skincare. It was just almost like, a lifestyle overhaul and a way to kind of orientate yourself in the environment, but also in symbiosis with the environment. So it speaks also a lot about industrialization when it comes to food, and also just generally the industrialized. It could even be education. It can extend that far. It's just a framework for orientating yourself. And I think in that sense, it's quite appealing, and it's also quite, nourishing and enriching because it can kind of seep into multifaceted areas of your life.
Right. I guess what people might say is that, we have different ancestors, right? Well, I guess if you go far enough back, we all have one common ancestor. But since then, however long ago that was, a lot of people have, populations have spread out across the earth, and, the kind of lifestyle of an Eskimo is far different than the lifestyle of a Maori tribesman. That's far different than the lifestyle of somebody, traditionally growing up in Russia or Sweden or Japan, or the Amazon, right? So how does ancestral health as like a movement, or the paleo movement, reconcile all of those different kind of ancestral templates? Is there some common template, or is there some, you often talk about bio-individualism? I mean, do you also have to take into account who this person's ancestors were, or if it's kind of difficult, mixed ancestry, do you have to try to take into account that not everything that I tell person A is going to apply to person B?
Yeah, I mean, I think there are overarching commonalities between all of the groups of people, you know, whether it was Inuits or whether it was, you know, people growing up in South Asia. It's just growing up, evolving. So yeah, I think the commonalities is not having hyper processed food and not, you know, sitting down in an office for hours and hours, or, you know, being extremely stressed and having road rage. There are overarching themes, let's say, and then the nuance is really in things like, okay, so we know, for example, lactose tolerance and intolerance is a big one, that there's a, you know, group of people in Northern Europe who developed an ability to digest lactose. They were able to keep that gene turned on even after childhood, when for many people it's turned off. So these kind of nuances, of course, if you're totally lactose intolerant, both your parents don't have the gene, it doesn't make sense to eat dairy because you're just going to feel bloated and inflamed all the time. So yeah, that in that more micro level, it really makes sense to pay attention to bioindividuality. And of course, actually, there are really sophisticated genetic testing now to show, I think one common one is coffee. How we metabolize coffee is can change depending on your genetic predisposition. And sometimes it can be useful to find out, although most people kind of realize anyway, you know, there are the people who have a cup of coffee and they're shaky and jittery for the rest of the day, and then others who are having 10 coffees and they're fine. So we kind of know how, if it affects our body if we pay attention. But those things, you know, it can be interesting to do. But if you're starting kind of from nothing, it just makes sense to take the overarching framework of, you know, whole foods and all of the things that I spoke about before, and then kind of focus down from there.
Yeah, one of the interesting things that I want to just highlight from what you said for me was that you know, like we weren't designed to like sit on a chair for like 9 hours a day, but maybe like I want to ask you about this, like, you know, traditional cultures, you often see them squatting, not so much sitting.
Hmm.
And maybe that's like healthier. That's one thing. And then the other thing that I wanted to touch on was the way that like we exercise, right? So like it oftentimes seems like we try to make up for like lack of like walking or like low level, low impact exercise. Like our ancestors got a lot of walking, right? Maybe they walked 20, 30,000 steps a day, maybe more in some cases, maybe slightly less in others, but far more than we walk, right? Like we walk maybe like 3 or 4,000 steps a day. A lot of people, you know, on average in a Western society, industrialized society, who don't make an effort to do it or build it into their lifestyle. And then we we see that we're not getting as much exercise, and we try to like, you know, load it up all and like concentrate it, and let's go running for like 30 minutes a day, you know, instead of having 2 hours or 3 hours of walking. Let's try to concentrate it and get the same benefits, or let's try biking. And so like you were kind of touching on, like running like may, you know, it just may not be something that we're designed to do for that much time, right? Like maybe short bursts is one thing, you know, running after like you know, or running away from a lion, or, you know, running after a gazelle. But like, you know, just making it like a chronic kind of like go for 30 minutes, 60 minutes, you know, multiple times a week may not be something that we're optimized for, and it may actually harm us. But also things like other exercises that we've invented, like biking, right? Like
Hmm.
it's just like not a natural movement for a human being to do. It's something that we've like built this thing, and then we're doing this completely new movement. So like you would expect it to cause, you know, like we're sitting all day and looking down at phones, or we're like looking at a computer, and like so our structure is changing, you know, over time, like the alignment of our body, but then also like certain muscles are getting too tight and other ones are too loose. And you know, like the shoes that you wear are like, you know, maybe like tightening up your, you know, the Achilles, and, you know, different things like that, having an impact on us. Yeah, like the HIIT exercise, like, you know, is that really healthy, or should we really be looking for like low impact, you know, and more of it? So I guess the question here is, I do want to kind of get your like opinion on the squatting versus sitting. Like, is squatting in some way healthier than sitting?
Yeah, I mean, I think that a lot of cultures still do squatting a lot. I mean, if you go to India and Sri Lanka and these kind of places, people are just squatting on the side of the road, in a way that seems like a yoga pose that no one can actually do in a class in Northern Europe or in the US. So, and yeah, it's very integrated. It's kind of a resting pose actually. So, but but then for people who aren't used to it, it's really hard to do. And I think a lot of cultures have traditions also of eating on the floor. So getting up and sitting down is just a natural part of what you do to eat. And in more Western cultures, there's this thing of chairs, and you're never sitting down and getting up, which you're using those squatting muscles. And there's a lot of theories about using those specific muscles and how they relate to staying healthy into older age. And that's why I think this is also one reason why squatting has become so popular, when it comes to CrossFit and Olympic lifting, and these kind of things are really big in the primal paleo ancestral health fitness world. Squatting is the thing that's really, really emphasized. And I think it is great. But then there is also the component that you said of, if you're sitting down all day and then you go to a CrossFit class, that's just, it's setting yourself up for injury really, because it's just you're sedentary and then you're doing something really explosive, really strenuous, and you're just kind of not prepared for it. And then, there's also the thing, there's some interesting data on how much hungrier certain exercises make us. So it can be that when you're doing this kind of exercise, you then overeat because you're just so hungry, and you end up actually consuming overall more, to a point that it would have been better in terms of calorie to and expenditure ratio to just not do anything, because then it just creates this in this crazy appetite. Whereas things like more slow and walking and maybe swimming, these kind of exercises I think are really underrated, because we're sort of designed to be doing those continuously throughout the day. But it's hard to integrate that, because for most people who have to work, it's just these things like we spoke about parking far away in the grocery store, or walking up an escalator, or I don't know, if you're waiting for a train, or going up and down the platform instead of just sitting. There are kind of hacks that you can do, but it is quite difficult. Or if you live in a city where you can walk, that's also a great thing. One thing that I try and do, people always find this strange in Lisbon, is that because I don't use public transport and I don't take Ubers or anything. So if I'm going to the grocery store, I just leave an hour earlier. And I think that it seems strange because it's just such a long time to get to the grocery store. It basically means shopping takes my whole morning, but then that's also my movement practice. And it's also the time that I'll listen to a podcast. So you're kind of integrating. I think this idea of integrating versus compartmentalizing is an important part for me of this paradigm. And yeah, like, how do we just integrate things rather than think, okay, now I'm working, now I'm going to the gym, now I'm doing this and doing that. It should just be like more of an effortless integration experience.
Yeah, I think that is really important actually, because in traditional cultures, what you'll see is that, just one example is like, a lot of people find it like impossible to have a meal without somebody else with them, right? It's
Yeah.
like
Yeah.
even if they're like taking a long trip on a train or a plane or something, and they like bring out their food, they'll give it to somebody else. Like they'll break their bread in half and give it to like the person sitting
Yeah.
next to them, and be like, you got to eat with me, okay? Because otherwise
Yeah.
I just have no appetite, right? And so
Yeah.
like traditional cultures made like everything social, right? Like there was like a social element to things. And so it's like not just nurturing your body, but also your like soul or your heart or your mind. You're like having a conversation at the same time while you're eating, and you're connecting with somebody, like having a heart-to-heart connection. And just like, it's far more nourishing than just like calories in, right? Like
Yeah.
it's everything in, right? Like I'm inviting everything in, right? I'm inviting all nourishment in, and like taking your time and like breathing, and like having a chance to catch your breath, and just like, when it's like a such a rich experience, it's like you're not so hyper focused on like just the food. Whereas like one of the things that you talk about also is like, maybe just like sit there and try to like enjoy your food, right? So like a lot of these people, like it's not so much like about like maximizing my enjoyment of like each bite. It's more about like maximizing the enjoyment of the experience as a whole, right? So like the food is a
Mhm.
piece of it. It's like, yeah, it tastes good, and that's part of it, right? That's part of what I'm, experiencing here. But there's like multi-layered, enjoyment. It's like I'm also enjoying connecting with the person, and I'm also enjoying like having an intellectual discussion about something or telling a story,
Mhm.
and just like the whole experience wrapped up together is what like you're really aiming for, which is actually like kind of what places like Starbucks are now working on, right? Creating this like experience for people, because like what they've discovered is people don't really care about the quality of the coffee. Like they
Mm.
want to walk into a Starbucks and have like an ambiance and like an experience, and like have a certain, like what they're really paying $8 for is that experience. And so that I think is missing for a lot of people. You got to create an experience, and not just like optimize the food. Like I'm a foodie, right? I'm gonna like make like the best omelet that's ever been made, right? Like I'm gonna fine tune my
Yeah.
omelet skills. So that was one thing that I thought of. The other thing that I wanted to bring up was yeah, like you said, you brought up yourself, like doing other things while you're walking, right? Like you can educate yourself, you can listen to a podcast, you can like have like maybe you sit there and you read every night, or maybe you watch like a video or a show or like a movie or something, but like maybe you can like shift that into like listening to an audiobook, or some other form of entertainment that you can do while you're walking. Or like say you get together with friends, and maybe usually you sit around and play cards or pool or something, like why not go for a walk, right? Like the enjoyment you can have taking a walk and having a conversation, especially for men. I think it's like you tell men that like, hey, you got to like increase your like your relationships, like you got to work on your socialization or something. You got to have like more like friendships, deeper friendships and stuff. And it's like the kind of the masculine kind of like personality doesn't, at least typically, like to sit down and like look at somebody and like have a conversation with them, right? It's like you like to do something with somebody else, right? Like
Yeah.
maybe it's like playing a video game, or just like walking with somebody, and you're not like staring at their face, right? And so but then you feel more comfortable. It's like I'm doing something with you, maybe we're working on something or whatever. And a lot of traditional cultures, you see this is not just with like men. It's not like women always sit there and like stare at each other's faces and talk, but like they were also oftentimes doing something together, right? Like now we're washing the clothes, and it's like a social experience, right? And now we're sorting the vegetables, or now we're picking the vegetables, or now we're like getting the stones out of like the lentils or something, right? Like everything was a social experience. It wasn't just like sitting in a house by yourself preparing your dinner until your husband comes home. It was like, let's have like socialization built into everything. And so nowadays we got to kind of like design our life for that, right? We got to find other people that want to like join us in something, right? But it's
Mm.
worth it to make the effort. So the other thing, just that I've been kind of thinking about lately is the link between certain like tests, like exercise things, like grip strength and longevity, right? So like what's your take on that? Like in the kind of like ancient world, like what was it that would have like given somebody a strong grip strength? Like they weren't just like nowadays you might go and like hang from a bar for like 2 minutes and try to like increase the amount of time you can hang from a bar. But like our ancestors, I don't think they were like
Mm.
hanging from bars like monkeys or something swinging through the trees. Like so
Mm.
what was it about their lifestyle that gave them perhaps those particular things that seem to predict longevity and a long health span?
Mhm. Yeah, I think before I talk about that, I want to circle back to the food idea, because I think there are the ritualization of certain things is something that's really important and missing. So and this also relates to all lifestyle things, not just food. So it's having separate places to do things. These days it's, especially with working from home, people eat and they work on the same table, it might even be in the same room they sleep, and just having a separate space just for sleeping. Okay, when I have my meals, I'm just here, and maybe I'm looking out the window, and
Mm,
maybe I'm I mean, one thing that I have is all of my plates and cups are handmade. I don't buy any kind of industrialized plates or cups. And I feel that I really enjoy having my matcha or tea in the morning because I just have this really nice cup. And the enjoyment comes from, as you said, somewhere beyond just the content of what it is. And ritualization helps with that. And also just bringing this kind of, I mean, it's this awareness to all of the things that support the experience. You know, it could even be your table or the view from your window or any of these kind of things to help to support the experience. So that's something. I think when it comes to the grip strength, it relates a lot to what you're saying, where these days we kind of outsource a lot of, you know, people who are really, really, really busy, say the CEO of a company, you know, someone else will wash his clothes, someone else will do his cooking, someone else will do his housework. And we're really not doing that much with our hands. You know, we're not cooking, we're not picking, we're not, here in Greece, a lot of people are sailors. So, you know, they're it's like they're tanks. They're just this mass of density and muscle, because the whole day it's just with ropes, and like just they can swim for, I don't know, 15 meters and pick up an anchor and come up. It's crazy the kind of things that they're doing, and that's just a part of their everyday life. And these days, actually, I was reading the other day that they're having in medical school, they're having trouble with dexterity when it comes to surgery, because people just don't have the same dexterity that they used to, because of just lack of use. And we're just reducing the number of activities we do, and also the range of motion. So when it comes to things like all of these new ancestral or primal ways of moving, there's things, there's one called fighting monkey, I think, as an example. And basically what they do is they work on skills like balance, like coordination, and also just how to articulate your body in a certain way. So, you know, we tend to, even when we're doing things like cycling or running or these kind of activities, we're just repeating the same motions over and over. But actually, you know, a joint or a shoulder or a knee has so many ways to articulate. And when we only articulate in one way over and over and over, that actually causes injury. You know, that's not healthy, because we develop in one specific way and then we're lacking in other ways. And, you know, the idea to move in a diverse way. So, okay, let's explore every way this hip can move. Let's explore every way your elbow can move. Let's do coordination, balance, like these kind of very primal and primitive skills that even focusing, you know, focusing close, focusing far, that's something that we also don't do. We're looking at a screen. We're not looking extremely close and then in the distance. These kind of, it's basically understanding the capabilities of every part of your body and then exploring the range and the depth of those capabilities. And I think that is a really nourishing movement practice to have, rather than something super repetitive like cycling, or which is actually more likely to set you up for injury.
Or like picking up like a bar and over again, right?
Yeah.
Like,
Yeah.
so some people are like, you know, pick up a stone, you know, and walk with it or whatever. So I think that's a good point. I want to kind of like take people back and like put this in a broader context, right? Like we're talking about, like we spent a lot of time talking about like, I think socialization, right? Like, or at least a little bit of time. And like, I think people oftentimes don't realize how important that is for general health. And so there's one study that is somewhat famous, you know, an Italian town, and I think this was in the 50s or 60s, some Harvard researchers went and studied them because they had like half the rate of heart disease of the rest of the country, but they really did nothing different than anyone else, you know, on the surface. I mean, they ate and drank the same, and they, you know, they smoked and they, you know, whatever, right? Everything was very similar to what the rest of the country was doing. And so the reason to study them was to figure out what it was that must be different in their environment to allow for that lower rate of heart disease, significantly lower, half the rate of heart disease. And what they focused in on, or what they discovered, was it was just like the socialization was what was different. They lived in like multi-generational families, and they had close friendships, and they spent a lot of time, just enjoying other people's company. So I guess like, like we're talking about ancestral health, and we're like splitting up into like these different things, like higher level categories, right? Like movement and diet and sleep and rest, and then like things like socialization, and maybe like getting rid of toxins or avoiding toxins, and detoxing, and there's probably more that I'm forgetting, but I think a lot of people are kind of like on the same page, like, yeah, obviously like movement and exercise is important, like we've all like we all know that, right? And obviously what you eat is important for your health. And I think we do need to spend a little bit more time on sleep. A lot of people don't realize how important that is.
Mhm.
But the socialization part, like it's a big pillar, and people, I think, have trouble understanding why it's so important, right? Like why doesn't social media substitute for it? So what do you think about that? Like, what can you explain how important it is, and why you think it's important?
Yeah, I mean, I think this has especially gotten more extreme over COVID because we've been isolated from each other, and especially people who work remotely and how have now not gone back to work and just continue working from home. I think it's hard because, I mean, it's very complex, but a lot of people have quite dysfunctional family units. So that is one aspect of it, where they might not get along with their parents. There might be, disconnects. And I think in older cultures, I mean, here in Greece, people actually live on the same property as their parents. And that's kind of just a given, like you live in the house next door, and then your parents live there, and then your aunts and uncles live there. So just the proximity of living together. And I don't know, even if you don't get along, like some of them don't get along so well, but they're always, picking each other up from there, giving fruit from each other's garden. I think there's just this sense of safety and sense of that there is someone there to support you in some way, unconditionally, that exists in more traditional cultures compared to this very, isolated. I don't know, I was looking at the statistics the other day about in New York City, just the number of people who live just alone, like it
Yes.
used to be that families, and then it was twos, and now so many people just live completely alone. And yeah, we're not really designed for that. But I think, I don't know, at least in my sphere, I think people are kind of, and especially since COVID, really gravitating back to this idea of community. And of course, it's built in different ways. Sometimes it's built through certain philosophies, or through movement practices, or just through, permaculture, or an interest in kind of going back to these traditions seems to be resurfacing. So that is good. But for a lot of people, there's just not, the connection in their life. And I think that I'm just thinking of this funny thing that I saw advertised in New York City, which is a party of people where you can go and just hug people that you don't know. I think it's called like Cuddle Puddle or something like that. So so it's just really, these things. I mean, I don't know I don't want to judge that either way, or like if it's good or bad, but it's, the fact that we need something like this, where a group of strangers get together and just hug each other silently for an hour, is kind of a good example. I mean, this has been born of the society that we're in, where people are really lacking connection so much that seems like something really appealing to do. So
Yeah, and people, I think, are seduced by convenience sometimes. So like the
yeah.
work from home kind of culture, it's like, wow, I mean, this is fantastic, but then you don't realize until later like what you're losing because of it, and the loneliness that it engenders. And so I think loneliness is a really big problem, especially towards the end of life. And for a lot of people, they, the people that they know slowly, pass away or something, and they slowly get more and more isolated, and the loneliness kind of creeps up on them. And the worst case is when you know end up in a nursing home and no one comes to
Mhm.
visit you. So I mean, I tell people who are sad to go to a nursing home and find somebody who doesn't have any friends or visitors, and just sit with them for like 15 minutes and make them laugh, and just be interested in them and bring them joy. So like when you get outside of yourself and like start to focus on other people, it helps you more than it helps them oftentimes. It helps you like lighten
Mhm.
your mood and lift your mood and stop being so like wrapped up in yourself. And so it's one of like the most effective cures for depression and anxiety, is to like get out of your own head and focus on helping other people. And that's just I think one of the things that everyone should be doing really, is going and spending 15 minutes with somebody in a nursing home, because those people need are important. And
Mhm.
in traditional cultures, the elderly were like elevated to a position of importance above everyone else. And we've done the opposite now. Like we've elevated our children to that position of like primary importance, and you know discounted the importance of the elderly. But we're all going to hopefully end up old, right? And so what do you think about that? I mean, what is it about our modern like society, the way it's developed? Why is it that we value the elderly less, and
Mhm.
the young more?
Yeah, I mean, I think this technology has a huge part to play in this, just because, when you think of grandma, we don't have this wise woman culture where we really value things like, I don't know, traditional medicine or ways to grow food, or the things that grandmas traditionally would know, how to make clothes, how to fix
Mm,
things. They
mm,
have that kind of wisdom. And I just feel like with technology, those things have just been made less important. And,
mm,
now grandma is super grandma because she doesn't know how to use WhatsApp or something like this. Like
mm,
we're looking at old people through this lens of, oh, being sophisticated or advanced is like being really proficient in technological use, and it's somehow correlated
mm,
with that. And these more, um, these different skills are just valued less, I think. um,
mm,
and then, I mean, I don't know about this because I don't, maybe I'm not exposed to as many old people, but I also wonder now, now that there's this exponential growth of technology, what will happen when people who are, say, my age are grandmas, but people who are my age, many of them don't have these skills even, right? They don't know how to cook, they don't know how to do these kind of things. So then that seems even worse. Like, what then do you have to offer, because you don't have those, and you also are going to be left behind on the technological front because maybe you're not working, or I don't know. Like, that's quite a scary thought to think of.
mm,
Because I think, I mean, my grandma personally, she has all of these. She's really good at gardening, she's really good at homeopathy, and she knows all about traditional medicines and oils and foods and all of these kind of things. um, so I really value her knowledge in that sense, but I don't know if that's really the case for everyone's grandma even now. um
yeah, definitely. Yeah, that's a great point. I mean, it's something that I didn't ever think of, so I'm glad I asked you. I never considered that. But yeah, I think that is a big part of it. And part of it is how we're everyone, like a lot of people, they spend their life hyper focused on like a tiny little job that doesn't really
yeah.
translate to the rest of society very well, right? Like their experience and their expertise is in like one little thing. And it doesn't, it's not super valuable for everyone else, although they do have some wisdom regardless, right, of life in general, right,
Yeah.
that they've lived through. And I think that is something that people should you know try to gain access to and value, just the general life wisdom, right? Like go and
Hmm.
ask like for advice, which is something that I think we don't do enough of nowadays. It's like your advice is like going to Google and asking like
Hmm.
finding something on YouTube, give me some advice, instead of asking human beings around you for like, hey, what do you think about like if I did this, right? Like um, I think that's a lot more valuable, and it helps you, to connect with other people, on a
Hmm.
human level, and just like increase the, your just the quality of your life. I think is to bring people into your decision making
Hmm.
process. The other thing I just wanted to mention. Oh, go ahead. Whatever.
Well, I was just going to say one more thing, because I think this is quite hard, because I mean, I even experience this with my grandma now. If I find her advice not really that useful, because the world that she lived in and grew
Mm,
up in is just so different to
right.
this. But there is a different kind of wisdom. So, for example, yesterday, my friend's dad, he said, "Oh, I'm not going to go on holiday this year because I don't want to miss fig season." And I was like, "What?" That's such a crazy way to miss reason to miss a holiday. Like, what? Because it's just this small window of 3 to 4 weeks. And he, like, I would never ask him, this friend's dad, for life advice, but this nugget of wisdom just really, I was like, whoa, yeah, you're so connected to your land that you're going to skip a holiday because you don't want to miss the season of figs, that all of your figs are going to grow and you're going to miss eating them, like, to
Mm.
just orientate yourself so much to the natural rhythms of the earth is amazing. And so I think the wisdom comes through in these different kind of ways, just being around older people and observing certain things they do that they might not even think are wise. He was just saying it in an offhand way, as if it was like completely normal that you'd skip a holiday because you didn't want to miss the figs. But for me, it was like my mind was blown. So yeah.
Yeah, I think part of what's going on is also that he probably, like, his whole life is like a holiday. It's like it doesn't really matter where he is. It's like he's gonna
Mm,
enjoy his life, right, at
yeah.
home, or maybe like now he's gonna go to another island or another, city or another country. But like, that's different than like what a lot of people, it's like, okay, this part of my life is like hard, and I hate it and I just have to do it, and this
Hmm.
other part of my life is where I'm going to enjoy myself, right? Like maybe at night I'm going to spend an hour watching Netflix, and like once a year I'm going to spend 2 weeks in the Caribbean or something. um that is like a lifestyle that's like designed to fail, right? Like you're just like
Hmm.
struggling all the time, and that's stressful, right? Like that's harmful for your health. And then having these like brief little windows of like, this is the time that I'm going to like enjoy myself and indulge myself and stuff like that. I think that is just a very unbalanced and kind of extreme way of living. And we got to bring, like, I think you've spoken about this with me before, about just bringing like this like awareness of enjoyment, or
Hmm.
mindfulness to like the every moment.
Yeah. And the integration that we're talking about, it's not this is for this and this is for this and this is for this. It's like, no, every moment is a combination of all of these things, and we're just flowing from one to the other with like slightly different proportions. And then that leaves us less predisposed to kind of escapist behavior.
Yeah, the other thing, just to kind of tie this all together and wrap it up with a bow,
Mhm.
is that like a lot of these things that we were talking about today are related to just like stress management, right? Like it's just kind of like building that into your life by the way that you live. And stress management is like a big part of what like lifestyle, medicine practitioners will come and tell you got to do, right? You got to like include stress management in your life, because like it's not so much like, a lot of people will tell you like, I don't feel stressed, like why do I need to like do yoga, or like listen
Mhm.
to like do a meditation every day, or do a breathing exercise 3 times a day? Like, why are you telling me to do that? I don't feel stressed out. And I think getting back to what we started with in the first webinar, about like kind of like this analogy of like a war going on in your body. Like there, like stress is more than just like what your brain considers to be stress. Your body is stressed out, right, by all the different like things that are in the environment that are kind of attacking you or placing a stress on you. So like toxins, maybe you have mercury in your teeth, and the inflammatory foods that you're eating, and the just the lifestyle in general, right, is placing stress on you. And so stress has to be viewed in this more holistic sense. And so stress management is a big part of healthy lifestyle, because there is just a lot of stress in the modern world that you need to deal with, even if you don't like necessarily notice it
Mhm.
mentally.
And when you normalize a level of freneticism that we spoke about before, when you really have a chance to slow down, I'll notice, when I go to the dentist in Greece, I'm like, this is so stressful. Like just being in the office is stressful, because it's such a contrast of stress compared to the rest of life, even though maybe in another context that would actually even seem relaxing. Like, oh, I get to sit down in this office for 10
Mm,
minutes. So it's just we have a different relativization of stress, and when we're able to tap into this awareness, like, oh yeah, my body's feeling some residual or level of stress, and just be more perceptive to where that occurs in everyday life. I think it's hard to do that when you're frenetic and when you're crowded out with other uh, just things in your brain and work and everything else that happens.
Yeah, definitely. So I think just to give people a preview, next time, I think what we'll talk about is maybe focus a little bit more on the different kind of like pillars of a healthy lifestyle, like what they are, and just like describe them briefly, and then also kind of like pull out the things that are important specifically for long COVID. Like I think they're all important for any chronic illness, regardless, including long COVID, but there are some specific ones that seem to be more important for long COVID patients. And I think we should mention those briefly, and then and also just kind of explain, like, okay, why should you sit through, like a longer maybe course or something, or like buy a book on different topics, right? Like what's the reason for learning more about these different lifestyle kind of interventions? And so I think that that's something that we'll talk about next time. So everyone, thanks for watching, and Michelle, thanks for being my
Thank you.
co-host here.
Thanks.
Hey, this is Dr. Syed.
Hey, this is Dr. Syed Haider, back with you guys to answer your questions after watching that episode with me and Michelle. So I did want to mention that we have Dr. Pierre Corey lined up for the longcovidreset.com summit, along with Dr. Mubin Syed and also Dr. Yusuf JP Salibi. He's also a member of the FLCCC, and he presented at the first FLCCC conference in Florida last month. And I think that the presentations at our Long COVID Reset Summit will be really great, because at the FLCCC conference, most speakers only had about 30 minutes to talk, and our speakers will have an hour or more. We have probably like 2.5 hours with Dr. Mubin Syed, which is amazing. A lot of Q&A with him. And we're hoping to be able to have Dr. Paul Merrick show up as well. So I'll be able to confirm that by Wednesday or Thursday. But we do have confirmations from the rest of the ones I mentioned. And, we kind of build the summit as a lifestyle change summit. It's really morphed into kind of like half lifestyle, but also supplements and medication protocols and cutting edge treatments, like, for example, triple anticoagulation protocols and things like that. So there's really a lot of stuff, and I don't think there's anything else like it on the web or anywhere in terms of the amount of information that we're going to be covering. And also, we did our best to make it, easily accessible for a non-technical audience. Dr. Risha Pretorius, who has been studying the anticoagulation protocols, the first 20 minutes of her presentation is pretty dense, even for me. Other than that, most of the presentations are very accessible for the lay public. So I highly recommend everyone register for that. The only way to watch it will be by registering at longcovidreset.com. And I will tomorrow be doing a live stream for my take on the FLCCC protocol and some of the changes that I've made to it, and covering the lifestyle recommendations, the supplements, lab testing, and the treatment protocol that we do. So I'm going to try to cover all of that tomorrow. And that's really meant to be kind of a pre-summit, sneak peek kind of thing, like what the kind of stuff that you're going to get at the summit in more detail. And so that will be up for about 3 days, and then we're going to take it down and just live stream it again, or stream it again during the summit, and it'll be available as a summit recording as well. And we're also limiting that to the Long Haul Reset Facebook group. So if you're not in that Facebook group, that's the only place we're going to be live streaming tomorrow. So if you're watching on YouTube or Rumble, then I recommend joining the Long Haul Reset Facebook group. or just registering for the summit. You can watch it November 18th to 20th during the summit as well, the replay of that. And I'm going to try to work on a Qigong presentation also. I'm not like a Qigong master or anything, but I have had my share of experience using Qigong, and it was, I think, one of the most effective things for me to recover from long COVID. And there are some, key factors in how to do it properly that I can tell people about as well. So hopefully I'll be able to do that during the summit as well. All right. So without further ado, I think I'll jump into the live stream questions. Crystal says, hi, hello. If time allows, I'd love to know the true effects and ramifications of the monoclonal antibodies, if known. I was not recovering and my doctor referred me to have them. They may have saved my life and I'm grateful, but I wonder if any of my long haul symptoms are potentially from that. So I'm not sure. I don't have any information or data on whether monoclonal antibodies have any negative effects, especially long-term effects. They are antibodies similar to what your body would create if it was fighting off a COVID infection. So there shouldn't be any prolonged effects, but I don't know. So unfortunately, we just don't have the data, right? There's a lot of questions that we have clinically, and we just don't have great data for them. And I wouldn't expect this to be a part of long COVID, so I can say that I would be very surprised if monoclonal antibodies set people up for long COVID. I don't think they would have any prolonged effect, personally. All right. The other question is, I'm lactose intolerant. This is from Cajun Land on Rumble. I'm lactose intolerant. I'm finding that lactose-free milk also bothers me. Is that common? So lactose intolerance, you can be lactose intolerant, and if that's the only thing in milk that you're intolerant to, then you should be able to consume lactose-free milk without a problem. So the fact that you're drinking lactose-free milk and it's bothering you probably means that you're intolerant to other milk proteins, which is also very common, maybe casein or one of the other milk proteins. So that is, it's quite common to have people develop milk intolerances or out-and-out allergies with long COVID. So this is one of the reasons that I do recommend some people try an autoimmune paleo elimination reintroduction diet to determine if they do have food intolerances that are contributing to their symptoms. These restrictive diets, I don't recommend people be on them for the rest of their life. I recommend it as more of a healing diet, restrictive regimen to improve your symptoms and relieve inflammation and basically reseal the leaky gut that might be contributing to some of the autoimmunity, and then test out and add back things one at a time and to be sure that you're tolerating them. Cajun Land also asks, is there something else you recommend besides yoga? Yeah, I like yoga, but I don't do a lot of it myself. I prefer Qigong. So tomorrow I'm going to be mentioning the Qigong exercises, and I can mention them here too. So I recommend lifting the sky and 12 nerve exercises specifically. Lifting the sky is really easy to learn. The 12 nerve exercises are a little bit longer, but once you learn them, take about 5 minutes to do. Also very easy to do, nothing complicated about either of those Qigong exercises and sets. And personally, for me, the most fast-acting intervention for decreasing sympathetic overactivity was the cold plunge. So what I did was I bought a chest freezer. I filled it up 3/4 of the way with water, and I sealed it with some sealant first, kind of the edges, and then filled it up with water, turned it on. After a couple of days, it's near freezing, 0 degrees Celsius. And I jump in once a day and I pour in some hydrogen peroxide every day to kind of keep it clean, and then dump it out after a week or two once it starts to get a little bit too dirty, and refill it again. You can buy like a $5,000 cold plunge unit. Or you can also DIY the cold plunge, which I haven't gotten around to yet, where you hook it up to like an ozone generator and a water filter and have like a timer that will turn it on and off to keep the temperature where you want it. So it doesn't seem like it's that difficult. And if you're good at DIY stuff, you could probably set all of that up for less than $1,000, maybe even $500 with a smaller cold plunge or a smaller freezer unit. And if you have very, very cold water where you are, you can try starting off with cold showers. They're not going to be quite as effective as a cold plunge. The cold plunge is really uncomfortable for me. So obviously cold showers are also uncomfortable, but they do not reach the levels of discomfort you get with a cold plunge. And so this very brief, extreme level of discomfort, my hands, I put my hands into the water also. My hands and feet are like hurting while I'm in there. I am not somebody who loves the cold. So when I first jumped in there, I could manage like 15 seconds or something. And then I gradually worked up to a minute over the course of maybe a week. And then in the second, third week, I was able to work up to 2 minutes. And but I have not found anything that's so quite as effective for anxiety, trouble sleeping. It's just extremely effective. And I didn't really even realize it, but I think I thought I was like 99 100% recovered from long COVID, and then I started doing the cold plunges, and I realized that I was having like some anxiety once in a while that also wasn't normal, and sometimes I would have trouble falling asleep. My mind would be racing a little bit. It wasn't as bad as when I had like full-blown long COVID, but all of that went away. And the final symptom that I had of long COVID that I think mentioned in one of my live streams was that at night my hand would fall asleep, and sometimes even down into my arm from bending my elbow. And that is probably because the ulnar nerve is a little bit swollen. And this, I just realized in the last few days, has gone away with the cold plunges. That's the only thing that I changed. The only thing I added. I'm actually not doing anything else. I'm not taking herbal treatments or anything like that for long COVID. The other thing it could be, I did start experimenting with intermittent fasting lately, but I think what I attribute this improvement to, and the last symptom of long COVID are the cold plunges. I think that they are just powerfully anti-inflammatory, and I think that helped to get the nerve inflammation to go away, so I don't wake up anymore with the numb hands. So it accomplishes a lot of what yoga and qigong accomplish, but very, very quickly. So it's very, very effective. And I know it's hard to work yourself up to actually do it. And sometimes I'll walk up to the chest freezer and stand there for a couple of minutes trying to work up the nerve to jump in. It gets easier over time, so I highly recommend that. Paul O'Malley says, "Did you have hyperosmia?" In the first month after COVID, I had loss of taste and smell, complete loss of taste and smell. I didn't have hyperosmia. I never had hyperosmia. And it recovered, like I said, after about a month, maybe 6 weeks max. The loss of taste and smell, they came back. Anna says, "Any treatments or recommendations for hyposmia? It's been 5 months for me." So hyposmia is a difficult one to treat. Anosmia is apparently easier to treat with the stellate ganglion block than hyposmia, but hyposmia may also be somewhat related to sympathetic overactivity, plus possibly microclotting and just inflammation. And so I would target all of those things to try to treat any COVID symptom, including hyposmia. So you gotta kind of cover all your bases with hyposmia and or parosmia. So I would get on the anticoagulation protocol with nattokinase and serrapeptase, because research shows that every long hauler has microclotting. And then on the anti-inflammatories like curcumin, dandelion, blackseed, and maybe some of the prescription anti-inflammatories like ivermectin, hydroxychloroquine, and then the things that help to deal with sympathetic overactivity, like cold plunges, yoga, meditation, etc. Guy says, "I really think that if young people would merge their minds with older people, that there could be a meeting of the minds using old knowledge and new tech. It's really a blessing that knowledge can be passed along so quickly." Yeah, I agree. I think that we just need more communication rather than less, and a way around censorship. So, the physicians on the front lines are also suffering from the censorship. Sometimes we're the last to know of new treatments, cutting edge treatments, and all of us are unfortunately suffering from that. I recently spoke with Dr. JP Salibi of the FLCCC, and he confirmed this for me, that a lot of times the first he hears of a new treatment is directly from a patient. Courtney says, "Mild pulmonary hypertension after COVID." This is this is a problem. So there's a lot of possibilities here. Microclotting could be a part of this. So increased vascular resistance due to the clots could contribute to pulmonary hypertension. And there's a lot of pathological possibilities here. And I would again treat it as I treat most long COVID. One thing that you might consider trying with that would be some of the nebulized protocols with iodine and hydrogen peroxide, very, very dilute hydrogen peroxide iodine. So basically something like 5 mLs of normal saline with a drop or two of iodine and a drop or two of 3% hydrogen peroxide is usually enough as a trial to do for maybe 7 to 10 minutes and as needed. There are other protocols that might be helpful that are nebulized as well. So I've never prescribed it to anyone, but I have heard that nebulized heparin is very effective for pulmonary diseases, even up to and including interstitial lung disease and fibrosis. Christine says, what causes the internal vibrations? I feel like these started or became a lot more noticeable when I added in B vitamins, but maybe not. So the internal vibrations, what I suspect they're due to are peripheral neuropathy. And I guess they could also be due to a central nervous system disorder. So we're not really sure, at the end of the day. The only thing that, the mainstream medical system has ever found in my patients to be positive were peripheral nerve biopsies for small fiber neuropathy. So the B vitamins, I don't know why the internal vibrations would worsen after B vitamins. Certainly B12 is important for good, healthy nerve function. And that's one of the first things you kind of think of and want to make sure that B12 levels are optimized, which I would, say would be above 500. I think it's milligrams per deciliter, but the 500 is kind of the cutoff for optimal levels, although the lab ranges usually go down to something like 200 or 300 is considered within the normal range. But again, this I would treat the same way as all long COVID symptoms, with a focus on anticoagulation for microclotting, and addressing the sympathetic overactivity and the inflammation that's going on with COVID. And it may be that if you have, the other thing that might help with healing peripheral nerve function would be photobiomodulation. So phototherapy, either sunlight itself or infrared therapy, might be helpful in healing the peripheral nerves. Christine also says, is colon hydrotherapy with ozone insufflation safe or a good idea for us long haulers? This is one of the things that you can try. So ozone insufflation is one of the easier ways to get ozone. IV ozone has been used as well for long haulers. And one of the doctors I'm in touch with is working on ozonated water that remains ozonated for 30 days. And that's, once that is out, I'll let everyone know, and that I think would be the easiest. He had experience using IV ozone and found that just giving people ozonated water was as effective as IV ozone. But ozone insufflation, as far as I know, is safe and may be helpful. I just spoke with somebody today who tried it and it didn't help. So all of these therapies, they work in some long haulers, but not all long haulers. So hyperbaric oxygen therapy is another one. It's quite expensive, something like $100, $200 per treatment. And oftentimes people do it 2 or 3 times a week for weeks or if not months. And you got to get the rigid one is the one that people have found effective. And some people find it's very beneficial. All their symptoms clear up. Other people find that it doesn't help at all. And even the people who do benefit, oftentimes will see that the benefit wears off. And so how is ozone working? As I understand it, it's probably mopping up free radicals. So maybe related to ischemia, reperfusion kind of injuries related to microclotting. So and hyperbaric oxygen therapy, how's that working? That's just increasing oxygen levels in your peripheral tissues. So also probably related to microclotting. And so if those things do work and you just can't continue them, I would really focus on the microclots and removing those. Kelly Good says, what are your thoughts on hot sauna versus ice bath for immune support strengthening? I think they're both effective for immune support and strengthening. So they both activate what are called heat shock proteins. Heat shock proteins were initially discovered due to heat shock on cells, but they're also activated by anything that shocks your cells, including cold. And they help trigger the deepest levels of autophagy, as Dr. Mubin Said is going to be talking about at the Long COVID Reset Summit that you can register for at longcovidreset.com. So both of these are recommended in general, but hot sauna can oftentimes trigger histamine reactions in patients who have an MCAS presentation of long COVID. So if hot sauna makes you feel a lot worse, you can leave that out. But it is great for tamping down on the sympathetic overactivity and also for boosting the immune system. And most people nowadays are using infrared saunas, and most of them are set to a temperature around 140, 150 degrees Fahrenheit. The studies on hot sauna that have shown the most benefit were set to a temperature of 180 or above. So somewhere between 180 and I think 212 degrees Fahrenheit. So as long as you get up to 180, you should be benefiting maximally from the hot sauna. And the sweating obviously is one of the most powerful ways of getting rid of toxins. So they've even found things like heavy metals being released in our sweat. So sweating is one of the most important ways of getting toxins out of your body. And the others are urination and defecation. Which also means you should be sure that you're urinating enough, and also your bowels are working optimally. So you should be having good bowel movements. Usually about 6 to 8 hours after the last meal, you should have a bowel movement. So if you eat 2 or 3 times a day, you should be having 2 or 3 bowel movements a day. They should be coiled up kind of like a snake in the toilet bowl, and not too hard, not too soft, but we can send a photo of the different bowel movement types and the one that's considered ideal for elimination and specifically for eliminating toxins. So Island Man says, I had COVID pneumonia in February, and after 11 weeks on oxygen, Dr. Haider dosed me with a course of ivermectin, I think IVT according to my weight, and it got me off of oxygen, but my right kidney still hurts. The hospital gave me 4 milligrams a day of generic for baricitinib by Olumiant, which is actually remdesivir. Now my right kidney hurts. I did a urine test and I have +3 blood. What now? So I can't tell you exactly why your right kidney is hurting. You do have some blood in the urine test, so it's possible that it's actually kidney inflammation and a kidney problem. It could be that you had blood before and it's not the kidney is hurting, that it's the back or something that's hurting, or a muscle. But let's assume it's the kidney. So again, after COVID, you were sick for a while, right? And so we can probably assume you have long COVID, or you did, and perhaps the right kidney pain is due to long COVID, in which case I would try again the blood thinners to, assuming that there may be microclotting there going on right now, as well as all of the supplements that I recommend, which I'll be sharing tomorrow during the live stream. And we'll also share a document a written document with all the supplements, lifestyle recommendations, prescription drug protocols for long COVID. Barbara says, do you think milk is good in general? And how do I know if I'm a long hauler? I think that if your ancestors benefited from milk, you are likely to benefit from milk. But some people in the modern world whose ancestors did benefit from milk have developed allergies or intolerances to milk. Some people tried drinking milk and their ancestors did not drink milk at all, and it just doesn't agree with them. They have serious problems drinking milk. There's different kinds of milk. I think it's A1 and A2 milk. So some people benefit more from the A2 milk. Some people's ancestors just drink goat milk, and maybe they don't really tolerate cow milk. So milk is complicated, And the other thing about milk is that it's not the same milk that our ancestors drank in general. Our ancestors drank raw milk, or milk that was heated up on a stove, not milk that was subjected to extremely high heat, and then and then homogenized fats in the milk as well, as we have nowadays. So there's a lot of things that are different about the milk today, as well as the wheat that we're eating. consuming. So, it's hard to say. It's a very difficult question to answer. Is milk good or bad? It really depends on the person and the kind of milk that they're drinking. So ideally, you would be drinking raw milk that was, taken out of the cow in a very clean manner. And the raw milk in the US is actually highly regulated and pretty clean. I would not trust raw milk outside the US. In for example, most third world countries, people boil their milk, and for good reason, because the hygiene is lacking tremendously. But in the US, the raw milk is actually has been shown, I think, to be far safer than regular milk. There's, if you go down the kind of rabbit hole of raw milk, you'll find that there's some great stuff at the Western Price Foundation, articles on raw milk. Michelle Harvey can share some of those. And I think me and Michelle have talked about this topic actually at one point. I think she maybe published an article or something about raw milk. We sent out an email about raw milk for breastfed infants, raw milk formula. And one of the links in that email, which we can share the email here. We may have published it also in Substack, I'm not sure. But one of those links was to an article, I think, on the Western Price Foundation, showing the number of adverse events associated with raw milk versus the number associated with regular, milk that's been homogenized and heated, and is supposedly safe, but may not be as safe as raw milk if it's produced correctly. So, long story short, it really depends whether milk in general is good for you or not. Jamie Schwen says, I've read that hydroxy interferes with autophagy while doing intermittent fasting. Is that correct? Yes. Hydroxychloroquine suppresses autophagy. So I start off with, in my protocol, I start off with ivermectin, low-dose naltrexone, and plus or minus a low-dose statin like pravastatin 10 milligrams. And then if you're not improving on that after 2 or 3 weeks, then consider hydroxychloroquine. So hydroxychloroquine oftentimes relieves people's long haul symptoms, even though it does interfere with autophagy. So I would first try the diet and the intermittent fasting and the supplements and the lifestyle stuff and ivermectin, low-dose naltrexone, and maybe pravastatin, and then consider adding hydroxychloroquine if none of those are working. And then if you benefit from hydroxychloroquine, I usually recommend staying on it for about a month and then weaning off of it as tolerated. And if it doesn't work after maybe a month or two, then stop, wean off of it anyway and move on to something else. So if you're really, looking for the autophagy aspect of things, then you might consider delaying hydroxychloroquine even more, trying other things first, trying prednisone, trying fluvoxamine, trying Maraviroc even possibly, and if nothing's working, then trying hydroxychloroquine. But I just recently spoke with somebody. Actually, I didn't speak with them, but they sent in a message saying that they had COVID and then they had brain fog afterwards, and then they requested another prescription protocol because they got COVID again. And this time around, we had added hydroxychloroquine to the acute COVID protocol, and they just took it for the acute infection, that second infection, and their brain fog went away. And the only thing they had changed was the hydroxychloroquine. Of course, they took ivermectin again. They took all the other medications again, but it may have been the hydroxychloroquine that finally ended their brain fog. Paul O'Malley says, can microclotting show up in the urinary tract? I had a mysterious 2-day event of hematuria, I think, followed by just mini clots in the urine. Full test showed nothing abnormal and otherwise totally healthy. This was end of my long haul, October 2021. Yes, microclotting can show up anywhere. Okay, mysterious 2-day event of gross hematuria, yeah, followed by clots in the urine. Yes, so microclotting is likely everywhere in the body. It's not limited to any particular location, and it is possible that it could lead to some bleeding in the urinary tract. So microclotting in some cases uses up all the clotting factors, and in those rare cases, people may be more prone to bleeding and may bleed longer, even though they also have these microclots that aren't able to break up. All right, Christine says, what can people with soy allergy or intolerance use for microclots instead of nattokinase? So I don't think lumbrokinase is from natto or anything like that, or from soy. So you can, assuming that's correct, yeah, it's a mixture of enzymes from earthworms. So try lumbrokinase instead of the nattokinase. Lumbrokinase, I've heard, is far stronger in its clotting or its clot busting capabilities. And some people, JP Salibi told me that in his experience, there's paradoxically less bleeding and less of a bleeding problem on lumbrokinase, even though it is much stronger at breaking up microclots. So lumbrokinase may be a good option for people with soy allergies and for people who tried nattokinase and it didn't make them better after a few weeks. Christine also says, is fasting safe if we have adrenal fatigue, dysautonomia, POTS? So it depends on the person, so some people with adrenal fatigue feel a lot worse with fasting. It may be that they just need to try fasting for longer, and maybe they need to try getting into keto, and maybe their body needs to go through a phase of adjusting. But yeah, so some people typically will tell you if you have adrenal fatigue, then fasting isn't good for you and you should be eating every 2 or 3 hours. So it's a possibility that some people may not benefit from fasting. And so, all of these recommendations depend on the specific person and, whether they work or not. And the other thing is, this also brings up or makes me remember the topic of the Herxheimer reaction. So some people will have what's called a Herxheimer reaction, which traditionally meant a die-off of something like Lyme disease or something like that being killed and causing a inflammation and a negative reaction and severe symptoms sometimes when you treat that person initially. So it's also, that term has been used nowadays to just mean any kind of toxin being removed leading to negative symptoms. So I'm going to use it interchangeably, either something dying off or toxins being eliminated and making you feel worse. So anything, even dietary changes, can trigger a Herxheimer reaction. So you got to try to figure out whether fasting is triggering a Herxheimer reaction or if it's making you feel worse due to adrenal fatigue. So either way, sometimes you might want to push through for a few days and see if your body kind of adjusts over time, and it may be possible that you feel worse initially, and then you start to feel a lot better. So it's very, all of these treatments are very specific to the person. And if you try something and it's just making you feel worse, and like you push through for 3, 4, 5 days a week and it's still feeling bad, you're just not getting better, then it may not be something that works for you and you may need to drop it and move on to something else. All right, so we have some older questions that I'll just go through since I'm on a roll here. Sursum says, have you seen catatonia as a side effect months after COVID? I've not seen that myself. Actually, today I just spoke with somebody, maybe I have. So somebody today was just telling me during a one-on-one consult that I don't know that they were catatonic, but they couldn't speak. And I mean, it looked like a stroke. And this did happen, I think, if I remember correctly, months after COVID, and they went to the ER and all the workup was negative. But completely catatonic, not, responding at all. No, I haven't heard of that. Ma Barley said or asked, can you recommend taking a chloroquine as a preventative, and is hydroxychloroquine the same as chloroquine? They're a bit different. They accomplish much of the same, and I have not heard people recommending chloroquine specifically for COVID prevention or treatment. So we are using hydroxychloroquine for both. I would recommend sticking to hydroxychloroquine it can be taken as a preventative. And, if you're very high risk, you can consider that. I personally found ivermectin to be more effective. Nowadays, some people, if they're really high risk and they really don't want to get it again, or, even for the first time, some people haven't had it yet, you might consider ivermectin and hydroxychloroquine both, along with just the things that you do, when you're in a high-risk situation, and if you think that you were exposed, or if you think that you're coming down with it, the most important things are like an early treatment protocol, especially hydrogen peroxide and or iodine nose rinse, mouthwash, gargle, and you can even go as far as nebulizing hydrogen peroxide iodine at very low concentrations, and killing anything that might be getting down into your lungs. Nancy says, has anyone had memory lapses where you participate in an activity with all normality and then the next day you have no memory of it, or it seems like it happened a week ago rather than the day before? I've heard this off and on from some people, having memory lapses. I think in the long haul reset group on Facebook, somebody mentioned that. They or their husband was having something like this going on. I got COVID about 10 days after my first episode, so maybe it's not related. But quite a few episodes since COVID, the first week of May. MRI and EEG all are normal. So that's interesting. You got COVID 10 days after your first episode. So yeah, it's true. It may not be related. If you're vaccinated, it might have something to do with that. So I would, consider, if you're not sure, it's possible that you had a late diagnosis of COVID. It's possible that it is due to COVID. 10 days seems like a long time. I don't know. It depends. I'd have to talk to you to be able to figure out whether it's possible that was due to a very, very early infection with COVID and then you didn't get diagnosed until 10 days later. Sounds a bit unlikely, but it's possible. Sursum says, what's the best way to supplement zinc and how much is best, and the food sources? So I've spoken about zinc maybe yesterday or the day before, maybe with Michelle. So Oyster Max is a zinc supplement that also has some copper in it. It's best to balance zinc and copper, and we'll include tomorrow during the discussion, about something about zinc and copper and the best ways to supplement it. But Oyster Max is a great kind of food that is taken from oysters. It's powdered oysters that are very high in zinc. So it's one of the most the highest zinc concentration in a functional food you'll find in oysters. So you can get powdered oysters and capsules that also have some copper in them to help balance the zinc intake. So I think that oysters are the best food source. There are some other food sources, of course. So you just want to kind of like look at your diet, see where you're getting dietary zinc, and then balance it out with some additional zinc. And zinc citrate, is a good one for for a supplemental zinc. But there's a number of different zincs that are okay, and we can share those with you. Maybe Dr. Laura has that, or Shelb has that document or something from Chris Masterjohn where he's talking about the different ways of getting zinc and different sources. Olga says, after the vaccine, I got EMF sensitivity that adds pain to my small fiber neuropathy in my legs. Walking exhausts me. Should I take H1H2 together with ivermectin and lumbrokinase? So, I can't give you direct medical advice because I don't have your entire picture here, your entire clinical picture. But I think that H1H2 blockers are something to try. Whether or not they're going to be beneficial for you specifically, it's hard to tell. Ivermectin, lumbrokinase, in general, yeah, those sound like a good place to start. But I wouldn't limit myself to those. I would try the entire protocol. So again, tomorrow I'll be sharing that on the long haul reset long haul reset Facebook group, and then the talk will be up for a few days, and then it'll be limited to summit participants after that. But I did talk about small fiber neuropathy a little bit earlier today, and with the EMF sensitivity, I would avoid things that trigger it. So that's one of the things that we recommend to people, and the FLCCC recommends, is behavior modification. What that means is you avoid things that make you feel worse. So it's important to avoid the things that make you feel worse, at least until you get better. And with small fiber neuropathy, one of the things that I think may be especially beneficial is sun exposure every day, or something like a sun lamp, or maybe even hot cold therapy to help stimulate, plus the blood thinners. Hot cold therapy to kind of stimulate blood flow to the peripheral nerves. Joanna says, I have some fatigue after COVID. Some days are better than others. Is there anything from a nutritional point of view I should start with to address the fatigue, or should have some labs done? So fatigue can be from a lot of different things. If it's just long COVID fatigue, it could be microclotting plus inflammation plus sympathetic overactivity oftentimes causes fatigue as well. Methylene blue is oftentimes very effective pretty quickly for fatigue. So that's included in the FLCCC protocol nowadays. We'll be covering that tomorrow in brief. So that might be one of the things that you can try adding. But what else? I would still do the entire protocol. So, because you want to address microclotting, which might be related to fatigue, and then you want to do things for the sympathetic overactivity. So yoga, meditation, qigong, tai chi, cold plunges, vagal maneuvers, vagal nerve stimulator, stuff like that. And the vagal nerve stimulator, you can get the free ebook from reliefbeginshere.com, which is Dr. Robert Groisman's website. He's the one who does the stellate ganglion blocks, but he also recommends the vagal nerve stimulator, and he has a protocol for that on his website in his ebook. Pixley says, I need statins to keep my cholesterol and triglycerides down, but I've recently learned that long use of statins can lead to diabetes. If that's true, which is more important? Yeah, so statins increases the risk of diabetes, which is something that most people aren't told when they're started on a statin, something like a 2% risk of diabetes over the long run. So I think statin, cholesterol and triglycerides are probably in most people a secondary. They're elevated secondary to some kind of inflammation. And I answered this question for one of our patients recently. What causes the inflammation that raises the cholesterol and triglycerides? It's oftentimes, gut inflammation due to gut dysbiosis or small intestinal bacterial overgrowth. It can be due to thyroid dysfunction. It can be due to what else? Metabolic syndrome, insulin resistance, elevated blood sugar and insulin levels. And there's a number of other things. There's like 2 or 3 other things that are very common causes of elevated cholesterol and triglycerides. So, if you approach it through the lens of functional medicine, oftentimes you can correct your cholesterol and triglycerides without requiring a statin. So that's what I would recommend, is seeing a functional medicine doctor. You can learn a lot yourself, actually. You may not even need to see a functional medicine doctor if you're willing to learn about this yourself. So Chris Kresser has a lot of, he actually has a course that helps you to get to the bottom of why your cholesterol and triglycerides are elevated. And he also has a couple of ebooks. He has a lot of articles that are for free. The ebooks are for free, and they talk about, cholesterol and triglycerides and what can elevate them and how you can get them down naturally. And in rare cases, sometimes people can't do anything but take a statin. The other thing that I would consider trying is the soleus push-up. So you can just look up soleus push-up. This is an article that was published in the last few weeks about a very simple maneuver you can do while you're sitting down at your desk for hours every day that can decrease your insulin, glucose levels, and your triglyceride and LDL cholesterol levels. And for some people, that might be enough to correct their metabolic dysfunction. So I would try to get off the statin if possible, by doing other things instead of relying on the statin. And cholesterol and triglyceride elevations aren't like an emergency that you need to take care of immediately. So you can stop the statin or wean off the statin and try to address the cholesterol and triglycerides by other methods. And if nothing else works, at the end of the day, you might, you got to talk to your doctor. What's your risk of, a bad outcome from the cholesterol and triglycerides versus the risk of developing diabetes? And you got to weigh those risks and benefits. In general, I don't like statins. But for some people, it may be the only option. The other thing that you need to do is you need to do advanced LDL and cholesterol testing. So you need to get something like the Cardio IQ panel, which can be done through Quest Diagnostics. And they look at things like LP(a) and a number of other advanced markers for cholesterol. And they look at the fractionated LDL. And so not all LDL is bad LDL, and not all HDL is actually good cholesterol. So you need to look at LDL particle number and a number of other advanced tests that aren't usually run in order to really figure out whether your cholesterol levels are actually negatively elevated. So some people have what would be considered high cholesterol, and it's not all bad cholesterol. It's actually good cholesterol, and they don't need to lower it. If your triglycerides are up, then you probably do have a problem, but it may be related to insulin and not so much fat and cholesterol, but metabolic dysfunction due to insulin levels that are too high. So there's a lot of things. It's a big topic. And I recommend looking up chriskresser.com, his website, for a lot of informative articles and work and research on cholesterol and triglycerides and correcting them. Elaine says, recommended ivermectin dose for histamine suppression. So, we start everyone off. Personally, I start everyone off at 0.2 milligrams per kilogram per day with food. It's important to take it with food, and then do that for a week daily. And then if you're not better, double the dose to 0.4 milligrams per kilogram per day with food, and continue that for 6 weeks and see how you do. So generally speaking, that works well. Some people might go up to 0.6 milligrams per kilogram today. We've never had to do that. Marilza asks if we could talk about the influence of 5G on human health. This is a big topic, and I think in general it's similar to just EMFs and the negative effects that EMFs have on people. So I do think that there's a lot of data and information suggesting it's quite harmful for human beings. And, just like everything, some people are a lot stronger to begin with and may not feel any negative effects, but they may develop negative effects over time. So, there's ways to mitigate this. If you're buying a new house or deciding on where to live, try to situate yourself, as far away from a 5G tower as you can, or from any cell phone tower. If you rent or live in a house that has, concrete walls, that does decrease the amount of 5G that gets in. And just leaving your phone turned off will decrease the amount of 5G, because the tower will find your phone, and it has multiple antennas, and one of them will send a signal to your phone if it's on. If there's no phones on in your house, you'll get less activity directed your way. But in general, some people can't avoid it. There's a lot of sources of EMF nowadays. It's not just 5G. There's also smart meters outside people's houses. And so, you got to do your best, unfortunately, with what you've got, with where you live. And I do think it's quite negative. And there's, like I said, there's a lot that's been written on this topic that's been widely suppressed. All right, so Angie says, one of my main symptoms about times with COVID was head on fire. No fever on the outside, had to be iced down. Now I'm losing my mind with 2 years of headaches, which when I never had them before. I've been an RN for 23 years. So this sounds like, you might have histamine related symptoms. So histamine, can cause headaches. It can cause that head on fire kind of sensation that you had. So your symptoms may be histamine related. They may be similar, a particular presentation of mast cell activation syndrome. So I would try the antihistamines, try Pepsid twice a day and Zyrtec twice a day. And if that's not working, then you can try other things like Singulair and maybe Cromolyn. But in general, you got to approach all long COVID type symptoms with the same thing. And any symptom that could be long COVID, you should be approaching it with the full long COVID protocol. But those particular things may be beneficial if the symptoms are due to histamine. They could also be due to sympathetic overactivity, in which case you might need a vagal nerve stimulator or a sympathetic ganglion block. So the headaches could be due to that too. And they could be due to microclotting. So you want to cover all your bases for anything that could be long COVID. Try to cover all your bases. All right, so just maybe one or two more questions, and then we'll wrap it up for the day. Jan says, I had COVID at the end of January. I'm still having nerve pain in my left arm that started after COVID. What can I do to help this? So again, inflammation, anti-inflammatories, address microclotting with nattokinase or lumbar kinase plus serrapeptase, and possibly hot cold therapy. You could maybe just limit it to your arm, ice and then heat alternating, may be able to help stimulate blood flow to the area and stimulate healing. So that's what I would start with. And autophagy. And neuronal autophagy is going to be maximally stimulated while you're asleep. And all autophagy is maximally stimulated 14 hours after your last meal. So if you can finish eating at least 14 hours before a period while you're sleeping. That's ideal for neuronal autophagy. And I think final question, maybe Kyle says, my neurologist put me on hydroxychloroquine 1 month in now, feeling better now after 24 months of long COVID. However, my tinnitus is worse. Thoughts on this medication? I know it's safe, just wondering if it's the reason I'm feeling better, because I recently quit caffeine, fast weekly, and got off blood pressure medication. So maybe one of these are the reasons instead of the medication. Anytime you do a lot of things at the same time, it's possible that that you may not be sure what's helping and what's not helping. So yeah, quitting caffeine could help because it's going to increase the amount of high quality deep sleep that you get every night. And it's also going to decrease your sympathetic overactivity dramatically. Fasting is going to cause autophagy. Getting off of blood pressure medication, it depends. That may or may not be beneficial. Hydroxychloroquine certainly makes some people a lot better. So you may need to maybe try weaning off hydroxychloroquine to see if you maintain the improvement. Why is tinnitus worse? I don't know. Any medication can cause anything as a side effect. So it's possible that, you could have worsening of tinnitus due to hydroxychloroquine. Hydroxychloroquine, as we mentioned earlier in this live stream, can decrease autophagy, so it can be reversing the positive effects of fasting. Caffeine also triggers autophagy, so quitting it may have decreased your autophagy at the same time as helping you in a lot of other ways. Generally speaking, I don't recommend caffeine, even though it can trigger autophagy, just because of all the other negative effects that it has for most people. So this is complicated. There's no way to really know what was helping, what's worsening things. So yeah, for some people, hydroxychloroquine is very, very beneficial for long COVID. So it's possible, and maybe even likely, that is what's helping you after 24 months, but I'm not sure which symptoms got better. So not that it matters that much, because really any medication can improve any symptom. I've had people who had tinnitus get better just taking ivermectin, and ivermectin doesn't pass through the blood-brain barrier, and doesn't usually have neurological benefits. Typically speaking, that's not how people think of it. They might think of like fluvoxamine or something as benefiting them with the neurological symptoms, but any symptom can be benefited by any medication. That's what I found with long haulers, that it's hard to predict which medication is going to benefit which symptom. Kyle also asked, said that he quit coffee a couple of weeks ago, and is decaf okay? I know it's still caffeinated, but like 97% less than regular coffee. Yeah, I agree. It's probably fine. You'd have to be remarkably sensitive with caffeine to have a problem with 3% to have a problem with decaf coffee. So probably fine. Yeah, probably not an issue at all. All right, so I see one more question here, and we'll just try to get to that. Alex, hi. I have been dealing with lung dysfunction from long COVID, which was aided by corticosteroids, prednisone prescribed by your clinic. I'm still experiencing mild persistent lung dysfunction despite my last COVID case occurring in January of 2022. What other treatments are recommended for long-term lung recovery? Yeah, so all the treatments that we recommend in the long COVID protocol, I would do all of them. Plus, we do recommend for lung problems that people try inhaled nebulized iodine and hydrogen peroxide. And if nothing else is working, we might even consider inhaled heparin or some other inhaled things, like maybe inhaled glutathione, nebulizer therapies. So, but I would target microclotting with nattokinase and serrapeptase, or lumbrokinase and serrapeptase, as well as inflammation and sympathetic overactivity, and do breathing exercises. Breathing exercises are incredibly effective for lung problems from COVID. Chris Masterjohn is the nutritionist. He's a PhD who has a great long COVID protocol for nutritional supplementation and lab testing. He himself, just read James Nestor's book on breathing, and started the breathing exercises. Within 24 hours, all his lung symptoms from long COVID were gone, just from doing deep breathing exercises. So in through your nose, out through your mouth, or just in and out through your nose also. So nasal breathing is very, very healing and effective, but also belly breathing. So breathing deep and pushing out your belly and then fully inflating your lungs. Breathing in for about 6 seconds, breathing out for about 6 seconds. That's one method of breathing that James Nestor recommends. Another one that's recommended would be In this one, you don't do that much. We do 4 breaths 4 times a day, and you breathe in for 4 seconds, hold your breath for 7 seconds, breathe out for 8 seconds. And then there's another breathing exercise, which is from Wim Hof. You can find that on YouTube, which is a 10-minute guided breathing session where you basically hyperventilate and hold your breath, and hyperventilate, hold your breath, hyperventilate, hold your breath. So 3 rounds. That's also very beneficial. So definitely look into deep belly breathing and nasal breathing for any lung problems. All right. Thanks everyone for watching, and I'll be back tomorrow. Again, it'll be only live streamed on the Long Haul Reset Facebook group, so please register there if you're not already there, and we'll leave it up for 3 days, and then it'll be part of the Long Haul Reset Summit, or the Long COVID Reset Summit. So longcovidreset.com. Please go there and register, tell other people about it. We are hoping to get Paul Merrick along with Pierre Corey, and Pierre Corey is confirmed, Dr. Mobeen is confirmed, Dr. JP Salibi of the FLCCC is confirmed, along with a whole lot of other amazing guests, physicians, health coaches, healers, nutritionists, all kinds of people. And tomorrow's live stream is going to be kind of like a sneak preview of the summit, where I'm going to try to cover like everything that we're going to be talking about, at least in brief, lifestyle stuff, supplement stuff, lab testing, prescription protocols, the whole 9 yards. All right, everyone. Thanks for watching.